Hello friends, welcome back. In this session, we are going to see a brief introduction to forensic medicine and task. So, as in this session, we should be familiar with what is forensic medicine subject is all about and its importance for medical students. Then, definitions of various terms like toxicology, medical jurisprudence, medical ethics, etiquette, etc. Various branches of forensic medicine and its importance. Then, different significant contributions by pioneers of the field to the subject. So to begin with, there are two distinct aspects of law-medicine relationship. One is forensic medicine, second is medical jurisprudence. In the past, these two terms have been used synonymously, but concept-wise, these two are totally contrasting terms. Let us begin with what is forensic medicine. The word forensic was derived from the Latin word forensis, pertaining to forum. So forensis, again meaning forum only. What is forum? Forum is a marketplace in the ancient Rome where, similar to our current day courts, legal matters were discussed and justice was awarded by the people with public responsibility. They act like juries or judges. So in the forum, that place, both the accused and the accuser were allowed to represent the facts of the case by putting arguments. Based on the reliability and strength of those arguments, then after analyzing the arguments, then justice was dispensed. So in the current day concept, the forensic, that term means court of law, which is similar to forum, where debates about various legal issues are carried out. So let us see what is forensic medicine. It is otherwise called legal medicine or state medicine also. In countries like Europe, USA, the term legal medicine is preferred compared to forensic medicine. Whereas in India, generally, forensic medicine is commonly used. Again, in certain medical institutions, a department is called forensic medicine and toxicology, and other institutions simply forensic medicine. Let us see what is the definition of this subject. It is a branch of medical science that deals with the application of medical knowledge to aid in the administration of justice. So it is one of the branches of medicine that deals with the application of medical knowledge. That is what the medical knowledge the student gathers in his entire tenure in the medical institution. That is knowledge from the preclinical subjects, clinical subjects, paraclinical subjects, etc. Applying that entire medical knowledge to help in the legal matters, okay, to help in the dispensation of justice for solving legal problems in the court of law, especially in the criminal cases, okay, pertaining to various crimes. So the doctor applying his entire medical knowledge to help the solving of various legal problems, various crimes by helping law enforcement agencies like police, then judiciary, etc. So simply we can put forensic medicine as applied to law. In India, the forensic expert is otherwise called a autopsy surgeon, medical legal expert or medical legal consultant, etc. Sometimes called a forensic pathologist also. Whereas in UK is called a coroner, and in most of the cities of USA he is generally termed as a medical examiner. Now moving on to next important term, that is medical jurisprudence. Again, this also derived from Latin word juris, which means law, and prudentia, which means knowledge. So knowledge about various laws of medical practice, to put it as simple. So how to define medical jurisprudence? That is the application of knowledge of law pertaining to practice of medicine. That is under having the knowledge of legal duties and responsibilities of a medical personnel. So the doctor has to have the clear knowledge about the various rules and regulations, various legal provisions that govern the medical practice, like rules of consent. What are the offences that constitute serious professional misconduct during his course of practice? That is as mentioned in the warning notice issued by the Medical Council of India. Then medical negligence cases. that constitute both civil and more serious criminal negligence cases. Then, what are the codes of medical ethics that governs the medical practice? The knowledge of various legal the provisions or laws that are also the doctor has to keep himself updated with the various amendments, newer laws, regulations that are being enacted time to time. So contravening these laws or legal provisions, the doctor does any act against the laws or legal provisions, then he may be punishable as per various sections of IPC, etc. So medical jurisprudence is a very important concept pertaining to medical practice. It is simply law as applied to medical practice. So for example, PCPNDT Act, that is a Preconception and Prenatal Diagnostic Techniques Act. That is more applicable for those doctors running the scan centers or physicians. If they come across during the scanning the sex of the fetus, they should not reveal it even if it is demanded by one or both parents. If they reveal it, they are again punishable as per various provisions of the Act. Similarly, doctor doing abortion has to have the clear knowledge of various provisions of medical termination of pregnancy, that is MTP Act. And the doctor again has to have a thorough knowledge of Consumer Protection Act, like this. So that is called medical jurisprudence. That is legal duties and responsibilities of the doctor in connection with his medical practice. Simply law as applied to doctor. Third is toxicology. It is another important allied branch of forensic medicine. That is why it is often called as forensic medicine and toxicology. So what is toxicology? It is a science dealing with the properties, action, toxicity, lethal dose, estimation of and the treatment of poisons or poisoning. It can be remembered by the simple acronym PETLET. That is a P for properties of poison, A for mechanism of action, T for toxicity. How it produces various clinical features of toxicity in the human body. Then lethal or fatal dose. Then how to estimate the quantity of poisoning in our body, and the treatment of poisoning, the treatment of patient in case of alleged poisoning, etc. That's all about toxicology. Then next concept is another important one, that is medical ethics. So what is ethics? The first year itself in the orientation you should have learned about following medical ethics while dealing with the patients and all. So what is ethics? That they are nothing but moral principles which should guide the members of medical profession, that is doctors, in dealing with mainly the patients, as well as in dealing with other doctors, as well as dealing with the state, that is state means pertaining to this government. So moral principles that govern the members of medical profession in dealing especially with the patients. So doctor has to follow the ethical codes while dealing with the patient. It is a self-imposed code of conduct assumed voluntarily by the doctor. So medical ethics applies for doctor-patient relationship. Okay, especially when dealing with the patient, he has to follow the ethics. If the doctor does some act which is considered as unethical by other doctors, then again he may be punishable based on the gravity of the offense, unethical practice. Okay, it is a very grave unethical practice leading to cause severe injury or death of the patient. He may be punishable. He may be imprisoned for up to 2 years, etc. Or the offense is less severe, doing unethical practice, like consuming alcohol or under the influence of drugs, seeing the patient, etc. Then if it is reported to the medical council, and concerned state medical council after inquiry may take action like a temporary or penal erasure of name from his from the medical register. So in case of temporary erasure, the doctor's name gets removed from that, he cannot continue the practice till it is revoked. or sometimes the offense is repeated again, or the offense is very gross, very severe one, then his name may be permanently erased also. Then in his remaining life he cannot do the medical practice. So that is why following the medical ethics, especially with respect to treating patients, is very very important under this various concepts of this medical ethics is vital for any medical practice. See in this picture, any unethical act are you able to find? Here, as you see in the table, he is holding the glass of some liquor and seeing the patient. This is considered as an unethical act, the professional misconduct also. See another in this photo, the doctor is talking with a tout or agent who seems to be procuring patients to his clinic. So he is giving some commission to that tout. This is called a fee splitting or a dichotomy. This also not permitted. You cannot split the fees that is collected from the patient to the laboratories, scan centers, touts, who are procuring patients to the clinic. So these are all considered as a fee splitting or dichotomy. This is again an unethical act, and a doctor may invite a punishment from the concerned state medical council by either temporary eraser or penal eraser, etc. Then fifth one is the medical etiquette. Whereas medical ethics is the moral principles pertaining to medical practice, medical etiquette is the conventional laws of courtesy that is observed between the doctors. Okay, conventional laws of courtesy. These are not written anything like a code of ethics, etc. So it is not punishable if the doctor contravenes the courtesy laws, etc. Okay. So this is a courtesy that is to be observed while dealing with another doctor. Suppose a patient comes with a prescription, doctor should not criticize the professional ability of another doctor in front of the patient. Okay, he should not denigrate that professional ability, or he should not pass any unwelcome comments about another colleague in front of the patients. So that is considered as he is contravened this medical etiquette. So doctor has to treat his colleagues as if their family member or a brother, etc. So he should behave with his colleagues as he would have them behave with himself. Suppose a doctor comes to for a consultation and he is waiting outside, you have to give priority to the doctor, or he has brought some of his family members, relatives, etc. for consultation. You have to give priority to without making them wait for long. Okay. So as soon as possible, you have to invite and you have to give the consultation to them. And with respect to fees also, you can give concession if possible, or you can treat them freely if another doctor comes for treatment, etc. So these are all the conventional laws of courtesy that is to be observed between the doctors. So medical etiquette is between doctor and doctor. If the doctor doesn't follow the courtesy, unlike this medical ethics, it cannot be punishable. Okay. Let us see various disciplines of forensic medicine. There are two important disciplines of forensic medicine. One is clinical forensic medicine, other is the forensic pathology. Clinical forensic medicine is concerned with dealing with living persons. That is, as you are seeing in this picture, probably seems to be a victim of assault who sustains cut injury on his right shoulder. So apart from giving treatment and stabilizing the life of this patient, the doctors have some legal duties also. Like at the time of discharge, he has to issue the wound certificate mentioning whether this particular injury on the shoulder is simple or grievous, which again help the judiciary to determine the charge and the punishment accordingly. So doctor's opinion in the wound certificate is very important here. So clinical forensic medicine is employed in dealing with various cases of living persons, like victims of assault like this. Victim and accused have to be examined in cases of sexual assaults like rape, and the doctor's opinion is very very important, whether the accusation is fake one or it is a genuine one. Similarly, in cases of alleged drunkenness, examination of drunken person, then age estimation, like this. This is coming under clinical forensic medicine. Okay, in the medical legal cases, uh, dealing with the living persons for giving an opinion. Then forensic pathology is that is the opposite. Okay, that is doing autopsy in the medical legal cases to find out the cause of death. That is whether it is asphyxia due to hanging, or died of electrocution, or died of burns, etc. So to find out the cause of death, manner of death, that is whether it is a case of suicide, homicide, that is murder or accident, etc. Then time of death, okay, time since death, when the death have occurred, like this. To establish all these important facts, autopsy has to be done in case of death of these medical legal cases to find out these important facts. That is called forensic pathology. Then these two are this clinical forensic medicine and forensic pathology are two important if we say two important branches of this forensic medicine. Then forensic odontology, that is application of knowledge of dentistry for the administration of justice. That is for determining age estimation based on eruption of temporary, permanent teeth, etc. Then forensic archaeology is the study of various bones, skeletons, etc. Forensic ballistics means study of different types of firearms like pistols, shotgun, etc. There are ammunitions like cartridge, bullets, etc. Then the problems arising out of their use. That is called forensic ballistics. Forensic biology means applying diverse branches of biology like molecular biology, entomology, that is study of insects, etc. Then forensic serology is study of various serological, immunological, histochemical examination of body serum. Then forensic psychiatry is applying knowledge of psychiatry in the administration of justice. Then forensic toxicology means studying the both medical and legal harmful effects of various poisons on the human body. Okay. So not only treatment of poisons, legal aspects of poisoning also, that is forensic toxicology, whether it is suicidal, homicidal, accidental poisoning, etc. So coming to forensic science laboratories. Forensic science and forensic medicine are not totally different fields. Again, forensic science is a multidisciplinary field with forensic biology, forensic entomology, forensic serology, then this narcotic division will be there. Then they will be dealing DNA fingerprinting, plain fingerprinting. This forensic ballistics is another important division of these forensic science laboratories. So this forensic science laboratory is coming under home department, both in the center as well as the state, and there are two types of forensic science laboratories are there. One is Central Forensic Science Laboratories situated in 6 places like Chandigarh, Kolkata, Hyderabad, Pune, Guwahati, Bhopal, etc. They are 6 in number. They are called CFSL simply. Whereas in all the states, state forensic science laboratories are situated. In Tamil Nadu, the main and the head forensic science department is situated in Kamarajar Sale, Mylapore, Chennai 4. That is called State Forensic Science Department, where main forensic science laboratory. So all the forensic samples in and around Chennai, those collected from these autopsy centers, they are being sent to this laboratory for analysis, for detection of poisons, etc. Whereas in the state of Tamil Nadu, there are 10 different places like Tanjavur, Madurai, Coimbatore. Regional forensic science laboratories, RFSL, are situated. They are also equipped with various facilities, but DNA fingerprinting, superimposition, that and all being done in the main forensic science laboratory at Chennai only. This is the forensic science department, which is situated against just opposite of Lighthouse and Kamarajar Sale. Whereas this is the regional forensic science laboratory situated at Madurai, nearby Madurai Medical College. Let us see the important contributors of forensic medicine and toxicology. The first medical legal autopsy was done by Anticius, a Roman physician, on the body of Julius Caesar. In the picture, you are seeing Julius Caesar being assaulted by a group of people with various weapons, due to which he sustained some 23 stab wounds all over the body. And this Anticius has done the autopsy on his body to find out which of these 23 stab wounds was fatal, which caused death. And he found that one stab wound which entered and ruptured this aorta, that is found to be a most fatal wound of all the stab wounds he sustained. That was the finding that Anticius established. But Anticius, that what he performed is not a complete autopsy. The entire body was not explored. Only he examined the trajectory of various stab wounds, their directions, where they terminated, etc. Not a complete whole body autopsy is conducted on that. First medical legal proper complete autopsy that is known to us is done by Bartolomeo da Varignano. That is the year 1302, done in the city Bologna of Italy. So he is the one who conducted a complete proper medical legal autopsy. He is called Bartolomeo da Varignano. That is this is important MCQ. Please remember his autopsy surgeon's name. Whereas in India, first medical legal autopsy was done in our Madras Medical College only in the year 1693 by Dr. Edward Berkeley on disease for a case of a suspected arsenic poisoning. Okay, he gave the certificate also. He was the one who gave the first injury certificate in India also. You can see opposite MMC. You can see now this his tomb. Oldest known medical legal code is called the Code of Hammurabi. The king of Babylon, he has made this Code of Hammurabi. Okay, collection of some 282 laws providing punishments for various offences, etc. This code, main principle of this code is eye for eye, teeth for teeth. Strict punishments are provided for offences. This is called Code of Hammurabi. This is the first known medical legal code too. Then, first book on forensic medicine was written by Fortunato Fedeli, a physician from Italy in the year 1602. He published this medical legal book. The Paulo Sacchia, otherwise called Paul Sacchias also. So either name he is used to be called. Paulo Sacchia or Paul Sacchias is an Italian physician. He has published 3 volumes of this medical legal that called Questionnaires Medical Legal book. Okay, it is published in 3 volumes, and he is considered as a father of forensic or legal medicine, as well as he is considered as father of forensic psychiatry also. So both father of forensic as well as forensic psychiatry is called Paulo Sacchia or Paul Sacchias. Father of modern toxicology, we have to go for Matthew Arfila. So these are the books are being recommended generally for forensic medicine and toxicology. One is K.S. Narayan Reddy and O.P. Murthy's Essentials of Forensic Medicine and Toxicology. That is the one we recommend for students, especially for undergraduates. And another book written by Dr. V.V. Pillai, that is called a Textbook of Forensic Medicine and Toxicology. Both these are standard books recommended for UGs for preparing for. So with the knowledge what we have discussed so far, let us solve these simply MCQs. Legal aspects of practice of medicine is called legal medicine, medical jurisprudence, clinical forensic medicine, medical etiquette, etc. Now what is the answer? Legal aspects of practice of medicine. Okay, not applying medicine for law. So medical laws, that is dealt in medical jurisprudence. Medical etiquette, as we have discussed, it is nothing but a conventional laws of courtesy between doctors. Okay, the conventional laws of courtesy. Whereas moral principles are that is discussed in the medical ethics in dealing with the patients, state, with the colleagues, doctors also. So these are moral principles between doctor and especially patient, that is medical ethics. The application of medical knowledge to aid in the administration of justice is called, it is a first definition we have seen of forensic medicine, otherwise called legal. So oldest known medical legal code is the Code of Hammurabi by the king of Babylon. Forensic, the term, that means crime investigation, court of law, legal procedure, legal knowledge. So as you have seen in the beginning, forensic means the forum which is which we can say connected with the court of law where legal matters are discussed. Father of forensic medicine and forensic psychiatry. Okay, he is nothing but that Balo Sakya. Whereas Bartolomeo di Varignana, I think you have remember what he has done. Bartolomeo di Varignana, Bulkley, these are all people. Whereas Paulo Sakya is considered as father of forensic medicine and forensic. This is a very important MCQ, often comes in the university exam. Father of modern toxicology, Matthew Arfila, Paracelsus, Bartolomeo da Varignana, William Herschel. So modern toxicology, M for Matthew, O for Arfila, we can remember that is Matthew Arfila. Suppose they ask father of toxicology and they gave only Arfila, you can go for Arfila only. Okay. Simply, instead of modern toxicology, father of toxicology, as given in some books of forensic medicine, you can go for Arfila also. If both the names are given and specifically asked father of toxicology, you can go for Paracelsus. Modern toxicology, Matthew Arfila, to be precise. First book on forensic medicine was written by Fortunato Fedele. Okay, Fortunato Fedele is the first book on forensic medicine. Whereas Ambrose Poeter is considered as father of modern forensic pathology. Okay, and William Herschel is the one who applied the science of fingerprinting for identification purposes, and India's greatest contribution to the world in the field of identification is the application of these fingerprints for the purpose of identification of criminals and for civil matters also. That is, William Herschel is the one who has first studied the various fingerprints and applied for the identification purposes. Whereas Alec Jeffreys is the one who is a pioneer in the field of DNA fingerprinting or DNA profiling for identification purposes. He is the one who developed DNA. First medical legal autopsy was done by Alec Jeffreys, Fortunato Fedele, Edward Bulkley, Bartolomeo da Varignana. So Bartolomeo da Varignana is the first one. Later in India, if they specifically ask, we have to go for Edward Bulkley. Generally, if they ask, it is Bartolomeo da Varignana only. Okay. So Fortunato Fedele is the one who first written the first book on FM. Okay. So that's all for today. Thank you. We meet you again with another topic. If you like this video, please share it with your friends. Thank you.